Good morning, friends. Now we are discussing ECG and its parts in module number 3, Human Organ System of the subject Biology for Engineers. What is ECG? Explain the various parts of ECG. ECG, electrocardiogram, is a graphical record that is produced by electrocardiograph, providing the details about how the heart rate is there in any human's body and its rhythm and any other related abnormalities of the heart beating. So ECG is depicting if the heart has enlarged due to hypertension, that is high blood pressure, or evidence of myocardial infarction previously, that is heart attack if the person is having any in the earlier time. So the ECG graph is shown in the figure with the key points P, Q, R, S and T. So it is one of the most common and effective tests for all the drugs. It is easy to perform. The test is very easy to perform, non-invasive. That is not harming the human body. It yields the outcomes very instantly and it is useful to identify hundreds of heart conditions. So we have different segments like a PR interval, that is from point P to R. So that is PR segment. Then we have QRS complex, that is the peak of the graph, and then we have ST segment. Then we have normal. In the normal ECG pattern, there is a regular pattern of the P wave, QRS complex and the T wave. They occur in a sequence. So normal, in the normal ECG pattern, everything is regular. P wave, QRS complex and the T wave. Then we have angina, that is when the heart muscle does not get enough blood with the oxygen. That is, the heart muscle is not having enough blood with the oxygen. It causes discomfort and feels like putting the pressure on the chest. This condition is called as the angina pain. Angina pain. Then an ECG has three main components: the P wave, the QRS complex and the T wave. So P wave is denoting the depolarization of atria, that is the squeezing. The QRS complex denote the depolarization of the ventricles. So P denotes the squeezing of the atria, QRS denotes the squeezing of the ventricles, and the T wave represents repolarizing ventricles. That is the ventricles gets relaxed and expand. So this allows them to fill up with the fresh supply of the blood. So they are ready for the next heartbeat. The P wave, that is the atrial action, the QRS complex, that is the ventricular action, and the T wave, so that is the recovery. So the three parts of the ECG graph representing atrial action, ventricular action and the recovery part. So P, atrial depolarization. So the top chambers will get squeezed. Then QRS, it shows the ventricular, that is the bottom part of the heart gets depolarized. So the bottom chambers get squeezed. Then the T wave, so that is representing the repolarization of ventricles, that is the bottom chambers gets relaxed. Thank you.